Welcome to Medico Apps PDS Express. In today's class, we'll be discussing one of the very important topic, and that is OSMF. Now, for the convenient, I have divided OSMF in multiple parts. In one part, we'll be reading just the definition and the clinical features, and second, we'll be reading the classification, etiology, and in this part, we'll be dealing with the management. Now, just let me give you a brief of OSMF. Okay, so before starting, let me tell you that if you have not subscribed to our YouTube channel, please do subscribe and press the bell icon so that whenever we update any new video, you'll automatically get updated. Now, OSMF. Let me give you a brief of this OSMF once again. So, OSMF, it is pre-cancerous condition, right? It was first described in the year 1952 by Schwartz, and the proper definition was given by 1966. So by Pinbock. So he said that OSMF. So the definition also, it is very important for oral pathology as well as for oral medicine. Examiner can directly ask you the definition of OSMF. So definition of OSMF is quite important. So it is described as an insidious chronic disease affecting any part of oral mucosa and sometimes the pharynx. Now it is the juxtaepithelial reaction which includes the fibroelastic changes, which includes the fibroelastic changes and the lamina propria, and which will eventually lead to the stiffness and the trismus of the jaw and inability to open the mouth. So this is the definition of OSMF. Now coming on to the management part. So it generally affects, here I'm writing, the age group which is generally affected is 25 to 35 years of age, and habit associated, basically the tobacco chewing or the areca nut chewing, to be specific, gutka chewing or pan chewing or areca nut chewing. It is the main factor for this OSMF, and apart from this, nutritional deficiency also. Now if we say nutritional deficiency, so firstly the OSMF treatment, it depends on which stage patient is coming to you. You need to check the mouth opening, you need to check the bands, then you need to check the uvula, then you need to check the protrusion of the tongue, all these factors, and then you need to classify that which category or stage of OSMF it is, and then you need to start with the management part. So in management, first and foremost is the tobacco cessation, then second comes the antioxidants. So in antioxidant, we generally go for SM fibro, so antioxidant capsule twice daily for 3 months after the cessation of the habit. Then iron supplements, basically nutritional deficiency, and in nutritional deficiency, iron deficiency, it is considered as an etiological factor for OSMF. So for that, we give Dexorange syrup and heme syrup for nutritional deficiencies. Then physiotherapy. Now physiotherapy plays one of the very important role in the management of the OSMF. So you need to advise the patient for physiotherapy. Now for physiotherapy, you need to tell your patient that first gargle with the warm water, that is the lukewarm water, and then they need to just stick the ice cream stick one above the another. Now they need to check how many ice cream sticks they can take in. Like suppose 8 ice cream sticks are going easily like this. So they just need to add one more ice cream stick to that. That means if 8 is going normally, they need to keep it 9, so that there will be some amount of pressure on the jaw or the bands, you can say. Right now here in this image, you can see in first image, they are measuring the mouth opening, right? Then in second, they are just putting the probe, and here you can see the ice cream stick. You can just put rubber band on the ice cream stick so that they don't move, and you need to keep it in both the sides, right? And you need to hold it for 1 minute or 2 minutes, whatever time you can hold. As long as you hold, it will be good for you. And then you need to check the mouth opening after a certain amount of time. So this is one of the most important thing, and usually we go for this for most of the patients. Then next is the benzydamine. Basically they are steroids. So triamcinolone gel, that is this gel. This we prescribe or crushed dexamethasone tablet in 20 ml of water, and it is to be used as mouth rinse. Then second is benzydamine 0.15%. Basically, it is available as Tantum mouthwashes. Then we need to give Levamisole. So this is immunomodulator. 150 mg once daily for 3 days, twice in a month for 3 months. Now you're supposed to give. So you'll ask the patient to take this Levamisole 150 mg for today, tomorrow, and day after tomorrow. Then they need to just skip this medicine. Then next week, same. Like say suppose today is Wednesday. Again, they need to take it for Wednesday, Thursday, Friday. Then again, they need to skip it for the next week. So like this, they have to take it for a month, or you can say for 3 weeks or 4 weeks. Like this, you are supposed to give this Levamisole. Now Pentoxifylline 400 mg twice daily for 15 days, and the commercial names, they are Flexital and Flowpent. Then apart from this, intralesional injections. So if mouth opening is of 2 fingers, then we generally go ahead with the intralesional injections. Now in intralesional injections, we give dexamethasone and betamethasone along with hyaluronidase 1500 units, which is basically available as Hylase. Along with this, you need to add Lignocaine 2 ml. Few practitioners, they tend to add this Lignocaine, and few they don't need this Lignocaine. They just directly give this intralesional injections at the multiple site once per week or twice per week for 6 weeks. So this is how you're supposed to give this intralesional injection. You need to just palpate the band, and you just need to give the medicine, or you can say injection. Then next is the interferon gamma injections, and last is the laser surgery. By laser surgery, you generally cut the fibrotic band. So this was the you can say mug-up session for OSMF management. Now management, it is very important. Solely short note can be asked. Complete long note can be asked on OSMF. So you need to write everything right from the definition to the etiology, classification, clinical feature, histopath features, if at all it is coming in oral pathology. And then you need to come on to the management part. Now management part, it is also important for postgraduate student, especially for the oral medicine and the oral pathology students, because entire long question can be asked on this OSMF. So you need to check the management part, the classification part, clinical features, and everything. And before finishing, let me tell you that we are even providing updates on your WhatsApp. So you can just directly press this link and you can just join to our WhatsApp group, that is www.medicoapps.org/groups. So in this, you need to just join your groups. We have medical groups and dental groups. So you need to choose your year very wisely. For first year, we are providing update related to first year content like human anatomy, dental anatomy, biochemistry, physiology. Similarly, for second year, third year, final year, for interns and post-intern. Hope you like the class. You can stay connected to us. Just press the bell icon so that whenever we update any new video, you'll automatically get updated. We'll just post small videos so that you can just mug up these whatever the topics is, and it will be helpful for you. Hope you like the class. Thank you.